Hello, this is Congressman Michael Burgess from the 26th District in the state of Texas. I'm a doctor and I've always been interested in health IT policy, and I appreciate the dedication of HIMSS to hold discussions about important issues, but I was especially grateful when I heard about the topic for today's panel. While I've served in Congress for 17 years, my prior career was dedicated to exactly what you're here today to discuss, maternal health outcomes. I was an OB-GYN doctor in North Texas for nearly 3 decades, and I delivered nearly 3,000 babies, and I saw firsthand the importance of providing high-quality care throughout a pregnancy and after delivery. All too often, we read about the stories of seemingly healthy pregnant women who are thrilled to be having a child, but then to everyone's surprise and dismay, suffer severe complications or death during pregnancy, birth, or the time period afterwards. The death of a new or expecting mother is a tragic event that devastates everyone involved, but in many cases there could be a preventable scenario. I believe it should be a national goal to eliminate all such preventable maternal mortality, and even a single maternal death is way too many. The alarming trend in our country's rate of maternal mortality first came to my attention in September of 2016, and I was reading a copy of one of the professional journals called the Green Journal. The original research found that the maternal mortality rate had increased in 48 states and Washington, D.C. from 2000 to 2014, while the international trend was moving in the opposite direction. Since reading that article, I've spoken with providers, I've spoken with hospital administrators, state task forces, and public health experts. And the more I dove into this troubling issue, the more I realized just how little we understand. As the chairman of Energy and Commerce Health Subcommittee last Congress, I chaired a hearing and helped move a critical bill to address the quality of maternal mortality data and enable states to establish or strengthen existing maternal mortality review committees. Thanks to the leadership of Representative Jamie Herrera Butler from Washington State and countless advocates, H.R. 1318, the Preventing Maternal Deaths Act, was signed into law by President Trump in December of 2018. Higher quality data will inform future policymaking and enable future states and hospitals and physicians to address the issue of maternal morbidity and mortality. Access to maternal care in rural and underserved areas is another issue, and it's important that we look at. I wrote a bill in the last Congress, H.R. 315, the Improving Access to Maternity Care Act, which established maternity care health professional shortage areas to help incentivize maternity health care to serve in underserved parts of the country. This bill was signed into law in December of 2018, along with H.R. 1318. While the 115th Congress was a great success in making inroads to improve maternal health and maternal access to care, I knew heading into this Congress there was going to be more work to be done. Last September, the Energy and Commerce Committee held a hearing, and at my request, we invited Dr. David Nelson, who's the chief of obstetrics at Parkland Hospital in Dallas. He spoke of Parkland's unique approach to providing high-quality care both before and after birth to his population, which is primarily Medicaid and uninsured. Following this hearing, I introduced H.R. 4996, the Helping Moms Act, which provides an option to states to extend Medicaid coverage after delivery for up to 1 year. I'm pleased to say that this bill passed the House in September, and I hope it will progress to become law. Congress has been busy trying to improve maternal health. Obviously, the work is not done. I hope you all have a very fruitful discussion today and continue to engage with Congress and help inform our policy making on this absolutely critical topic moving forward.